Hi and welcome back to my channel. My name is Carlise. If you're new, thank you for joining us, and if you're a returner, welcome back. So as you see by the title, today's video is going to be a simple nursing school essentials. If you didn't know, I just passed my second semester, so now I'll be entering into my third semester of nursing school in the spring, and I'm so excited. So I thought, what better way to end this year and entering the new year with a nursing school essentials video. Now I know some schools have enrollment only in the fall, however others have enrollment in the spring. So I decided to go ahead and just film this nursing school essentials video, and I hope that you enjoy this video. So without further ado, we're going to just go ahead and get straight into the video. So first things first is you need a book bag. You need a book bag. The one I have, now it's heavy because like I said, I just finished. Sorry, it cut off for me. I don't know. My phone's doing crazy stuff, so bear with me. But you need a book bag. So like I said, I just finished finals on Thursday. Today is Friday when I'm filming this. So yeah, this is what bag I've been using for nursing school so far, and this is by the brand High Sierra. It's really full and thick, give you some things to look forward to. I possibly in the new year can do a video on what's in my nursing school book bag. I'm not going to go through it. I like this book bag because it had many compartments. So it has like a compartment here, has one there, it has one here, and then there's the big one back here. And as you can see, I have a lot of books and papers and binders, and I usually can fit like a binder in here plus my laptop, and my binders are thick. So really great book bag, great for your money. I'm not going to go through everything in the book bag, but while I'm thinking what's in here, some nursing school essentials is Post-its. As you can see, I've been using mine a lot. There's only like that much in there left, so I'll have to get me some more for spring semester. And highlighters. I don't know if mine are in here. They are. I just have the different colors. As you can see, 2 are missing because I was using them this past semester. But yeah, just a pack of highlighters. And I like to get the different color package so that I can change colors for different classes, different notes, things like that. So yeah, you need a book bag. Nursing School Essentials is also a clinical. Look, today's just a day, but I'm determined to film this video. That's my line going in and out. Sorry about that. Really? That's what we gonna work on getting for Christmas, is lighting. That's what we working on, okay? Just bear with me. I'll make this real quick because apparently everything's acting up. But I just have this book bag. This is just a backpack. This says one team, one goal, making a difference. I actually got this from my job for Nurse Aid Week or Nurse Aid Month, Nurse Aid Week. They handed out all of these to us, and I use it for clinical. Now, I won't be using this big old bag because as you can see, it's really big. I won't be using this when I start working as a nurse, but this just is good enough to carry all my books and stuff for school. So, just keep that. Nursing school essentials, you need a watch that can tell the time. I have just one of those watches you find at Walmart for $9 and $10. Just got one in white, nothing special. I know my school does allow Apple Watches, so if you have that, that's fine. Pen light. I got my pen light from, I can't remember, and there's no name on it, but I just got a regular pen light. And the thing that I like about this pen light is that it has on the side the different pupils, so I like that part. And then I have a blood pressure cuff manual and a stethoscope. Now my school only required us to have the stethoscope, but mine came in a set, so I got me the, regular manual blood pressure cuff. I got this set from F.A. Davis. It's a store that's located in Fayetteville, North Carolina, but they do online stuff. And this is the brand Prestige Medical. This was really expensive, and this was like $100, but I'm going to be a nurse for the rest of my life. This is it. I've fully made a commitment to do this, so I thought, why not go ahead and start investing into myself and my future. So yes, it's a lot, but this is my investment into my career. So I just got black just because they had other colors, burgundies and blues and gray and white, but I chose black just simply because the fact of, like I said, this is going to be my stethoscope for my career, and I just want to get black. I don't know where the Lord has plans for me to go when I work, and I don't know policy wise and what the uniform colors will be, so I just decided to get black so that it would go with whatever scrub color I'm required to wear. So yeah, I got that, and they gave me extra stoppers because I've been bad about losing those ear stopper pieces, so I just keep that in this bag that it came with. Next, nursing school essential is some type of NCLEX book. So I went ahead and got this NCLEX book from Amazon. This is the Lippincott Q&A review for NCLEX RN. This is the 12th edition, the 12th one. So I got this from Amazon. It was $30, I think. Again, investing into my future. This has a whole bunch of questions. So as I'm in nursing school currently, whenever we talk about a chapter or section to help me prepare for the test, I do some of these questions, and then of course once I graduate next December in 2019, I'll use this book to help me study for NCLEX purposes. So I just went ahead and started investing in my future and picked up this book so that I can start practicing questions now as I'm in school, and then I can have this book again to use after I graduate from school and I start to prepare for the NCLEX. So again, just all about investing in your future. There's other books like that. That was just one that was recommended to me by a lot of people in my program, so I just went ahead and picked it up, and it's been really a great resource. Next thing that you will need some sort of is a drug guide. My school had access to get like the Davis drug guide, or if you didn't, another drug guide, but I just have this one. This is the Davis drug guide. This is, I don't know if there's a 15th. This is the 15th edition, so it's purple like this. Pick this up. Great for having all the terms in here. And this is just a simple med book to have with you in nursing school when you're looking at medications and you're not familiar with them. I will say this isn't probably the best user friendly. For instance, all of my blood pressure medications that are in the ACE inhibitor classification are under the term ACE, and so you would have to know that that's a blood pressure med, and you'd have to know they end in PRIL, or else you would be looking for them all over in the place. So they do have some of them grouped in their classifications, and if you don't know the classification, I just wanted to make sure that was safe. If you don't know the classification of the med, then you may have a little bit of difficulty looking up meds in this book. And of course, this is the 15th edition, but there's no drug guide out there that's going to have all the meds in the world in the one book. So there are some times when I'll look up a med and it's not in this book. However, meds come in, they come out, they have new ones every day being created and placed on the market. So there's no way any one drug guide can have all the meds in the world. So just keep that in mind when you're looking, that they're not always going to have all of the meds in there, but you do what you can. Index cards are a must. Now, it depends on how you study. I don't write everything on index cards because, let's be honest, nursing school is a lot of notes and writing and reading, and there's no way I could fit all the amount of information I need in 300 cards. Like, I would need so many more. So just different terms that I don't understand or that I know I need a little bit more reinforcement in, I'll write them on the index cards and study them that way. So I don't use this a lot, just for when I'm not understanding something, because like I said, it's just a whole bunch of notes and I'd be here forever writing. So I don't do that. Another great thing to have is some type of reference manual. Now let me take that off because that has some school information on there. But this is just a simple diagnostic reference manual book. This is by Sparks and Taylor. This is their nursing diagnosis reference manual, and this is the 10th edition. Looks like that. This is just for, you know, your when you're needing help with doing care plans and, you know, forming outcomes. This does a great job. This book, I will say, does a great job of helping with care plans and outcomes. They do separate them in categories. So in the front of the book, you'll have all like the greens, and that's for regular adults, and then you'll have like orange is for, like, I think the blue is for toddlers, I think orange is for newborns, and there's like purple in the back of the book for geriatrics, which is your older clients. You will have, I think orange is like psychiatric and mental. There's blue is maternal and newborn. There's one in here for like community health. Red is child. So yeah, they have orange for adolescents. So they don't just have different care plans and outcomes in here, but they do categorize them in the age range or the type of, you know, situation your patient is in. So if you're looking for an older adult client, you can go to the back of the book in the purple section, look up some possible care plans for that particular patient. If you had a newborn patient that you need to do a care plan on, there's a section specific to newborns. So I love that feature, that it separates them and it realizes, you know, sometimes an older adult may need this type of care plan, which is more realistic for them than a you know, average middle-aged adult. So I love that feature of this book, that it separates them like that. It's great and it's easy for me when I'm in school and I have like an older adult patient this day and I have a middle-aged adult this way. So that's been great. I don't have like a lot of essentials. Obviously, I'm still growing in nursing school. There's still things that I want to pick up and buy. I mentioned earlier that the bag I had at the time is something I use for nursing school. I have noticed on my floor that there is like a tote per se. I'll insert a clip of it somewhere in here. There's a tote, and with the tote, like, you can put your initials or monogram it, but it has like the middle part is for like books or your binders and stuff like that, and then they have pockets on the outside for like pens and highlighters and Post-its and, you know, paper clips. So I want something like that. It's like a caddy, so that it'll be more resourceful when I'm a nurse. Going back into essentials that I do have currently, this is Davis's also Handbook of Lab and Diagnostic Tests. This is the 7th edition. Now I haven't gotten as much use of this book as I have my reference manual and your guide, but I'm pretty sure as I advance on in the program, I will have to rely on this book a lot more. This basically just has different lab tests and diagnostic tests, breaks it down what the tests mean, why you would do the diagnostic test. It tells you some things to look for, so nursing care, some nursing interventions, some things that can go wrong with the diagnostic test, and like for the lab values in here, they have different reasons why, like, your sodium level will be high, or different reasons why your potassium level may be low. So they just break it down for you to understand the normal ranges versus the abnormal, and to tell you why a lab test would be abnormal. So it's a good book. Like I said, I haven't gotten much use out of it, so I'm not familiar with it too much. I've only used it once or twice so far, but maybe I'll get some more use out of it. Sorry about that. I'm watching a Hallmark movie and my favorite part came on, and, you know, had to watch it and cut you guys off for copyright reasons. just one more quick essential, well, two actually. One is investing in some good shoes. This whole video I've been talking about investing in yourself, investing in your career as a nurse. And I invested in some shoes. They're by the brand Grey's Anatomy. With my school, we had to wear, it's required we wear white scrub shoes. So I invested in some white scrub shoes by the brand Grey's Anatomy. They were $80 or more, but like I said, investing, they're really great. I've used them for 2 semesters now, and they're great. I haven't had any problems, issues with my feet hurting. Haven't had any problems with staining, any issues with it not being comfortable with my foot. They have really good cushion on the inside, just for cleaning and cleanliness purposes. I keep my shoes at the door outside, so that when I'm headed to clinic, I just put my foot on at the door, head out, and then when I come in, that's the first thing I take off at the door is my shoes. So I'm not tracking, those germs from the hospital into the house. So I don't have them here, and I'm not going to get them. Like I said, cleanliness. So I'm not going to bring them here, but the last nursing essential I would highly suggest investing in is a good binder. Now, I know you've had to have seen, I said binder, clipboard. I know somewhere, somehow, you should be seeing clipboards like these. Now, this type of clipboard, this is from White Coat Clipboards. This is the brand of the clipboard. I picked up mine, not from their website, but from Amazon for $20. They have different colors: black, gray, white, purple, blue, pink, maybe. I don't know. They have different colors. Go on Amazon, find you one, pick your color out. The thing I love about this is, and they have ones for different professions. This is the nursing one, so just keep that in mind when you're looking and buying. But this has injection sites, pupil sizes, blood values, and what type of needles to use. Lab values are up here, and conversions on the back, and just like a pain rating, and then on the side like a ruler. So I think this is a great investment. Working as a nurse realistically, and as a student, you can't have all these papers, all these binders, and having this where you can just flip either side is great. As you can see, it's a binder that folds, and it's great to fit in your lab coat pocket. So I would highly suggest picking this up from Amazon. If you don't get anything else in this video, I would highly suggest this. This has been a great investment into my future, and I love it, and I know it's sturdy, so it will last me for a long lifetime. So thank you for watching. I hope you enjoyed this video. Hope you seen some things that you can invest in yourself, and good luck to you in your nursing program.